We've been exploring the opiate overdose issue in Somerville over the past month. The epidemic is sweeping the state, and Somerville has not been spared. During the first 3 months of this year alone, at least 6 people have overdosed in Somerville. In our last newscast, former addicts and their family members stood up to share their stories. This week, reporter Yushao Yun talked to Aldermen Matt McLaughlin and Patty Contente from the city's Trauma Response Network to learn about the city's efforts.
In the Morse Kelly playground, a plaque commemorates the spot where a 16-year-old died of an OxyContin overdose 20 years ago.
We felt at the time that, this death, while tragic, might at least lead to people changing their behavior and realizing the problems with opiates. And unfortunately, it was just the first of many deaths to happen. And it's a problem that's happened in the early to mid 1990s, and it is still a problem today.
As a Somerville native, Alderman Matt McLaughlin witnessed many overdose deaths while growing up.
And I feel like a lot of kids kind of lost hope. The dreams they had when they were young got diminished and shrunk a little bit. And when it came time to face reality, people weren't ready for that. And it was a lot easier to stay in this drug world than it was to, pull it together and, go to college and all these things.
What upsets McLaughlin even more is the lack of funding for inpatient rehab programs in the city.
One of the things that killed me most of anything is in 2008, around that time period, at the height of our previous opiate epidemic, the Somerville Hospital closed their rehab center. The clear thing we need is just more resources, more time and money allocated towards getting people into treatment.
Patty Contente from the city's Trauma Response Network is also concerned.
There is definitely a lack of beds for the number of people who are suffering from addiction, meet that diagnostic criteria. There really just aren't enough inpatient beds. But what more is concerning is there is no continuum of treatment. But there are, I think that one of the main things that we are trying to do in Somerville and on a community level is really work in partnership with community groups. There are many. There's Somerville Overcoming Addiction is a very active community group. And they are willing to partner and volunteer and assist in many ways. So we're trying to look at training resources. We're considering recovery coaching. How can we bring that resource as a way to provide alternative community supports while folks are waiting for those treatment beds and longer term treatment.
Item 10 is a resolution submitted by Alderman McLaughlin.
The Board of Aldermen are taking action. On May 14th, the board passed a resolution encouraging police to help addicts, not to arrest them.
I hope Somerville could take a page out of Gloucester. And the city of Gloucester is come out basically saying that if you come to the police station and ask for help with the substance abuse problem, they will help you, they won't arrest you. They said that any addict who comes to the police headquarters will get, quote, an angel to walk them down the road to a detox recovery.
A long time, they have a quarry, they can't get a job, they're back in this terrible cycle. If we can stop that before it starts by treating people, instead of putting people away in prison where they don't belong and they only get worse and we only make criminals out of people, that is the productive route.
The city and the police department are moving in the same direction. According to Contente, Somerville recently hired a substance abuse counselor to work at the police station.
The goal will be to ensure that family members have information on resources to support themselves and gain knowledge about how to support their loved one in recovery, and then also to reach out those impacted by addiction to offer opportunities for support to engage in treatment and resources that will help them to recover.
The new initiatives will likely help, but will they be enough?
It's a big cycle. There's prevention, stopping people before they start. There's helping people when they need the help. And then there's helping people after the fact, because once you're addicted, you know, you're a recovering addict for the rest of your life. Even if you go years without using, the drug has such a hard hold on you that, you know, you're considered an addict forever. So we really need beginning, middle, and end treatment to this issue.
Somerville is fighting back as the other families across the nation do. But these are only small steps in the long-term battle. We'll keep an eye on the local efforts. For Somerville Neighborhood News, I'm Yu Xiaoyuan.
In 2014, Somerville joined the Massachusetts Opioid Addiction and Prevention Collaborative to develop strategies to fight the epidemic. For information on outpatient programs at the Cambridge Health Alliance, visit www.challiance.org/services/addictionservices.aspx.